Ladies and gentlemen, today we stand here before you with a message of unity, of solidarity and of coordination. This pandemic has tested our resilience as a union like nothing before. We all remember too well the first days of the pandemic, the unilateral actions, the border closures, the restrictions in the movement of essential goods. We have come a long way. Through unity, coordination, and solidarity, we can beat this pandemic. The success that is our vaccine strategy is the strongest testament to this. This is a shield against the virus, a shield that protects our citizens. The fact that now, 10 months into the pandemic, and 6 months after we presented the vaccine strategy, citizens are being vaccinated with 2 safe and effective vaccines across the EU is what will be the biggest mass vaccination exercise at this scale, and speed speaks volumes in itself. It speaks about the value of investment in our scientific excellence, trust in our capacity to produce innovative medical products at scale, and to share the benefits between us equally. About how 27 are stronger than 1, about how 1 is as important as 27, regardless if they come from a big or small member state, about the concrete added value that this union can bring to the lives of each and every citizen, about how a united Europe can play a strong geopolitical role with its belief in humanism, in solidarity, and in multilateralism. Solidarity is the second element, because no one is safe unless everyone is safe. No one can put an end to COVID-19 unless the virus is eradicated everywhere. Our vaccine strategy was never about the EU first. It was always about giving a fighting chance to everyone, including our neighbors and low-income partners. Very soon, we'll be able to announce donations of vaccines to the rest of the world. And vaccine donations will be the geopolitical issue of 2021. Europe will not shy away from its moral and political responsibilities. Team Europe has already mobilized over 850 million euro in support of the global initiative to ensure equitable access to safe and effective vaccines of COVAX. We are COVAX's biggest donator. None of this would have been possible if we had not worked in solidarity. And this solidarity needs to be further reinforced to ensure that everyone overcomes the challenging weeks and months ahead. Coordination is the third element, because the problems we face in the virus cannot be addressed in isolation. At least 3 new variants are raising cause for concern because of how fast they spread. If we do not act now with determination, we might not be able to contain the risk of a potentially harsher third wave. Numbers are already worrying across the EU, and hospitals are under a lot of pressure. We cannot be complacent. And while vaccines are being rolled out at increasing speed, it will take time until it reaches all Europeans. We are calling on member states to do more genomic sequences of these variants, to share the information at EU level with partners. If we don't test and sequence, we are blind. We stand ready to support them, to increase capacity for sequencing, to mobilize funds to purchase genome sequencing equipment, to make available the ECDC sequencing capacity, and to complement national capacity with this. Our leaders are meeting in 2 days to discuss COVID-19 coordination. What we would like to see transpiring from this discussion is a united front to beat COVID-19. This is our call to them. Today, only with 2 vaccines authorized so far and made available at the same time and in the same conditions to every single member state, more than 80% of the EU's population can be vaccinated. We have used the negotiating strength of 27 member states and 450 million people to ensure the broadest portfolio of safe and secure vaccines in the world. And more will come, I hope, in the coming weeks. The opinion of the European Medicines Agency on the AstraZeneca vaccine can come by the end of this month already. And the vaccine of Johnson & Johnson is also under rolling review. Today, we have common recommendations on testing. We have joint procurements on the purchase of medical equipment and supplies. We have interoperable contact tracing apps and a coordinated approach to free movement, to mention just a few of the achievements of the last months. I have said this to many of you many times already. We are racing against time, but not against each other. But we're all racing together as one team. As a team, it is important to set clear and ambitious targets. And as a united team, it is important to support each other to achieve these targets. Vaccinations do need to speed up. And as Vice President Skinas has already said, this is why we are calling on member states to meet the vaccination targets set out in this communication. And these targets are achievable, and we will help member states achieve them in any way we can. In addition to maximizing vaccine production and access, we are securing the supply of vital medical equipment needed for vaccination by an EU joint procurement for syringes and needles. And we're also asking member states to update their testing strategies over the coming weeks to reflect the new variants and incorporate the use of rapid antigen tests. And here we're supporting the scale-up testing capacity by direct purchases and joint procurements. Ladies and gentlemen, huge challenges lie ahead of us in the coming weeks. Our unity will be our strength. The past year has shown this very clearly. This is the only way to begin to see the end of the beginning and to embark at the beginning of the end. I'm sure that the EU heads of state and government will hear this call on Thursday. Thank you.